Good morning. It's Karina from Embrace Midwifery Care and Birth Center, and I feel like my light today is really lousy. So I apologize. I probably I'm just failing somehow this morning. It feels like I'm a little off, but I'm going to try to do this anyway. So bear with me. So this is Karina again. I'm with Embrace Midwifery Care and Birth Center in Richmond, Virginia, and a thing that has been coming up a lot lately is client responsibility versus provider liability. So what this means to me is, what is the responsibility of the client to have a safe pregnancy and birth versus what is the responsibility of the provider? In our country, which if you're seeing us from somewhere else, the US, puts a lot of the responsibility of outcomes on, especially in obstetrics, on the provider. And in some cases, that is absolutely, absolutely good and accurate, and that's what we should be doing. However, I want to talk about some of the middle ground there. Hi, Heidi. A long time ago, a wise old midwife told me a midwife should never work harder for a healthy pregnancy and baby than the mother is willing to work for herself. So let's think about that for a minute. Let's say, and this does happen a lot, I have a mom who develops gestational diabetes, more than I'd like to talk about actually. And let's say that was a mild case and it could be diet controlled. So this mom in this example does not want to diet control her diabetes. She doesn't want to go through that hassle. She doesn't want to give up her carbs or her donuts or her good stuff. And so her glucose continues to be out of control. Now, in a traditional medical model of care, the physician would say, I can give you some medicine for that. I can manage the complications around the birth with that. So on we go, right? You want to do it? Great. You want to leave it alone? Great. You want to take your meds? I don't care, because whatever happens at the hospital, at the birth, we're going to face it as it comes. If the baby's big and there's a shoulder dystocia, if there's a hemorrhage, if there's a complication, we can manage that at the hospital. We do it for, like we handle it like we handle it for a living, right? In midwifery care, we can handle all those things, but we don't want to if we don't have to. So in this situation, it's really important for that client to take control, to take responsibility, to monitor her diet and her blood sugars, and to be really vigilant so that we can essentially minimize those risks, and we can have a healthy pregnancy and a healthy birth. Because guess what? Gestational diabetes, if you can food and diet control it, the risks virtually, they go away. So here's another example of at what point is it the client responsibility versus my liability? I get asked all the time. So let's stay with this one for a minute, actually. Let me finish that one. So in that case, as a midwife who specializes in low-risk, healthy moms, she has to go back to medical care if she won't manage her diet and her glucose. That's a choice she makes. I cannot manage her glucose for her. That is not, I can give her good information. I can give her tools. I can give her, but I can't go and take the food out of her hand and say, no, donuts are going to cause your sugars to go up, or ice cream. That's a patient responsibility, a client responsibility to take care of that. If she wants an out of hospital birth, if she wants a healthy baby, right, to be born here. But one of the more common things that I face, so things that aren't even that big, but in our country, I have a list of things I'm supposed to tell my moms that they need to do. Things like, don't drink. Now, as a provider, the answer is there is no safe level of alcohol that has been determined during pregnancy. We haven't determined a safe level. Don't drink a drop. It's fine. The question is do you think the women in Italy give up their glass of wine on Sunday night? Or do you think that there's healthy babies born where mom does have a glass of wine once in a while? And the answer is, of course there is. Of course there is. So here we go back to, as a provider, my liability and my responsibility is don't do it. As a client, what responsibility do you want to take around these issues? If you choose a glass of wine, I've told you it's not safe, even a drop. If you choose, it's all on you. What this does for me is it puts me in a quandary because I want to be honest with my clients. We are supposed to say no deli meats. No deli meats, no soft cheeses. Listeria is terrible and awful, and you can't, we want to avoid that. But you know what? There's 800 cases of listeria a year in America. Maybe 1,500 on a bad year in a year, not just pregnant moms, everyone. Some studies say that it's a 0.34 per 100,000 risk. You have a greater risk of dying in a car accident on the way to work than developing listeria. But yet here we are again in America where my responsibility is to say absolutely not, no, no, no. And why is that? Why can't I just give information to mom? Why can't I say, you know what? Yep, if you develop that, it's definitely dangerous. Yep, it's devastating to babies. Yep, we've got risks around it. Why can't I make that statement? Why do I have to have an approach of, no, you absolutely cannot? And here we go back to responsibility versus liability, right? If I say no, my liability's done. If you eat some, ham and get listeria, I told you no. You can't come back and blame me. But the reality is moms eat lunch meat all the time. The risk is small. The risk is low. It's much lower than many of the other things we choose to do in our day-to-day lives. Listeria, wine. It's to the point where as a provider, my job is to say over and over and over again, nope, don't do it. Nope, don't do it. Nope, my responsibility is to say no. The CDC tells me that I need to tell you that you have to have a flu shot. That's my responsibility. How many of my moms get flu shots? 10%? Maybe? They choose not to. The CDC tells me that I'm supposed to tell you that every pregnancy you need a Tdap shot. Every pregnancy, a Tdap should be good for 10 years. And if you read the package insert, it says that it hasn't been proven safe in pregnant women. So as a provider, I don't feel like it's my responsibility to lay down hard laws for you to live with. I say it this way a lot. I don't get to decide to put a helmet on that baby when you teach him or her to ride a bike in 5 years. I am not the parent. And parenting starts at conception. Parenting starts with taking responsibility, doing your research, and choosing your risk. You choose the risk. You choose the risk to ride in a Geo Metro or a Humvee on your way to the birth center. If you were in an accident, obviously one of those is going to probably stand up better than the other. You chose your risk. You chose where to live. Sometimes because of the crime risks. You choose how you do your life. Are you going to go raft the river? No, that's too much risk for you. Risk is everyday life, and client responsibility means that I give you good information and you choose the risk that feels safe or feels good to you. That's true whether we're talking about taking a Tdap. That's true whether we're talking about listeria. That's true whether we're talking about water birth. That's true whether we're talking about birthing out of hospital or in hospital. Again, client responsibility. There is risks in being out of hospital, and there is risks in being in hospital. Every mom has to find their sweet spot, their balance, and find out what feels best to them. Now, the next step to this equation that is really challenging, so we've talked a little bit about, but for me, clients are the ultimate decision makers. My job is to give information. And like I said, I can say, hey, the CDC says you need to stay away from lunch meat. But the reality is, I also need to tell you that the risk is low and that you need to make your own decision. But here's the other side of this, is that at some point as a midwife, I build this relationship with you of trust enough that when we actually do go into birth together and that baby is coming, if there's something serious happening, you trust me. And it no longer becomes the client's responsibility to make decisions to save that baby. That becomes the midwife's responsibility. My job is to keep you and your baby safe, to get you through the journey of pregnancy and birth. But like I said, I don't go home with you. 1 hour of prenatal care does not determine a month. 1 hour you spend with me does not determine what you do for the rest of the month. That's prenatal care, and that's where you must take responsibility for the outcome of your pregnancy and your birth. This is where you choose every day how you're going to navigate this pregnancy. And really it's about how you navigate life, right? Some people find life to be a joyride, and no joke on joy there. Hi, Lindsay. And they don't worry a lot about different risks. And some people worry about every risk, and whatever style you are, that's what we're going to work with here, right? Like that's back in your lap. So as midwives, we talk a lot. I send you home with a book this thick at 32 weeks with informed choice documents, evidence-based articles, the most current ones I can find, so that you can do your research and we can make good decisions together. We can establish your birth plan and we can honor that. One of the things that my clients choose a lot is oral vitamin K. Now we offer IM vitamin K here. We offer, which is intramuscular, the shot that you just, oh look, all of a sudden I have light. Maybe the clouds moved. So in the hospital in America, babies get vitamin K shots. It helps prevent intracranial bleeds in particular is what we worry about. But in other countries, they offer oral vitamin K. And I won't negotiate like the pros and cons of an IM and some of the things of an intramuscular shot here. But for whatever reason, some of my moms want to do oral. We offer it. We offer a great quality of one. We offer one that meets international standards. We offer it with the Danish protocol that has also been adapted by Stanford University. Now, why don't we offer oral vitamin K across the board in this country? Why is that not on the table? And I'm going to tell you, it's back to provider liability. So as a provider, yes, Christy, I think that you could absolutely give your client some good information. If it's accurate and current and evidence-based, I think that's a service as a doula that you can offer them. I don't think that as a doula you have the ability to discuss it the way their midwife or OB can, but you certainly can give them the information to take to that provider. I think that's true. So, so vitamin K, why we don't offer, my perception of why we don't offer oral vitamin K in our country is because we don't trust our parents. They show up, they have a baby in the hospital, they're discharged, they're not seen again for 6 weeks. The baby generally isn't seen again for 2 months until the 2-month visit where there's vaccinations to be done. And in order to have a safe oral protocol, you need to give drops every 2 weeks, or excuse me, every week, 2 drops every week. And again, that's the Stanford University protocol that we recommend. Golly, I'm sending you home with a new baby. Can I trust you to give 2 drops of vitamin K once a week? Well, I hope so. You're a parent, for crying out loud. At what point do we finally let go of you? And trust that you're going to do what your baby needs. I find it really irritating, but at the same time, I also kind of understand. I work with very proactive clients here, and that is not the reality out there in the world all the time. So what I'm able to offer my clients is different. And I truly believe that the information I give them, my liability is giving them good information and talking them through it and supporting their choice. Their responsibility is making the right decisions for their pregnancy, their birth, their baby, and their child for the rest of that child's, 18 years. So here at Embrace, we do it different. And Lindsay, who's hanging out there with me, is our new old midwife. So she's been around a while. She's not a new quote unquote midwife. She's done lots of babies and lots of births. She's coming in October to be another Embrace midwife, and I am so excited to have her. She's going to be such a great fit. But it's important that we understand as midwives that our job is to give good information. Clients' jobs is to use that information appropriately, make the right decisions for their family, and take responsibility for their outcomes in those situations. And that's a big difference in us in medical care, where every mom gets the same tests, every mom gets the same ultrasounds, every mom gets the same treatment. And that's those are checking those boxes so that the doctor's liability becomes less and less. I did it all. It's not my fault that she had XYZ. For us, it's the opposite. We talk about all those boxes, and then we trust that you're going to make good choices for you and your baby. And so that's all this morning. It's been on my mind because of listeria. I've had like 4 moms ask about listeria this week, and I'm like, listeria. And then I had a mom going to Italy, and she's like, can I have some Italian wine with dinner over there? And she was like 32 weeks. I'm like, wow, do what you do. It's not for me to live your life, just like it's not for me to raise your baby. So good information means you make decisions that suit your beliefs and your lifestyle. I appreciate you joining me, and I'm sorry my energy is low this morning. I feel like I'm kind of worn thin, but that's because lots of good stuff is happening here at Embrace. Babies, babies, babies. Everybody have a great day, and remember that we do tours Tuesdays at 10 and Saturdays at 1. I always screw that up, and we'd love to see you come by. Thanks, everyone. Bye-bye.